Fibromyalgia, ADHD, bipolar, anxiety and depression. They are not completely separate illnesses because they are coming from the same part of the brain or the network in the brain. And we need to get that right. This is not something I have made up, rather it is something suggested by modern neuroscience. For many years, fibromyalgia was always described as chronic pain condition or even chronic pain syndrome. But research is showing something a lot more deeper, especially up here. Many patients are showing neuroinflammatory responses, pain processing alternation, at the same time, hypersensitive peripheral, specifically central nervous system. Basically saying that your brain is amplifying signals which are normally harmless. Now, the most interesting part is that ADHD frequently coexists with fibromyalgia and other chronic pain conditions, suggesting an overlap of neurological pathways. Fibromyalgia is commonly also seen alongside other mood disorders such as bipolar and depression. Most likely because these conditions share a disruption to the same brain's system when it comes to pain perception, stress response, and emotional regulations. In simple terms, a dopamine system, stress system, as well as pain system. And when all of these systems dysregulate, you are going to experience brain fog, fatigue, emotional instability, and chronic pain. This is actually quite exciting because a new area of research is emerging. Medications like MJ and other GLP1 receptor agonists, originally designed for diabetes and glucose control, including weight management and hunger hormones, appears to not only have an effect when it comes to the gut, glucose control, pancreas, and appetite, but it also shows that it can influence the brain's reward system. Further adding that these interventions may influence things like dopamine signaling, neuroinflammation, and reward pathways, which all are involved in mood disorders and addictive behaviors. This is according to the earliest research. In fact, in a much larger studies from recent times has shown that those people taking GLP1 medications has been linked with lower rates of substance addiction and related harms. This could be possibly due to how these interventions modulate the brain's reward system. But we do have to be careful because these interventions, like Mounjaro, is not currently approved to be medications or used for managing fibromyalgia, bipolar, depression, or ADHD. Evidence is still developing and we just simply don't have enough research as of yet. But the research is showing something quite important and large. Conditions like fibromyalgia, ADHD, bipolar may not just be psychological or purely physical. They are deeply interconnected disorders of the nervous system or the brain or the central nervous system, as well as having an influence on the peripheral nervous system. Future management of these conditions is not looking towards treating each symptom separately, but it's about understanding the body as a network and the whole network, including metabolism, inflammation, gut and brain axis, brain chemistry, nervous system, pain regulation, and much more. This, ladies and gentlemen, may completely change the way we view chronic illnesses or understand chronic illnesses, hopefully having a much better impact for the future and management of chronic conditions.